Working with people who are seriously ill means that you'll regularly be sharing bad news with them, something that we all find difficult. So what is bad news? It is the gap between expectation and reality. Remember, you can rarely predict in what way and how sharing bad news will affect patients and their families, so don't make assumptions. However, communicating well is a skill that can be learned. Much like inserting a cannula, we can avoid the pain of a clumsy communication if we learn and practice those skills. So I'm going to use a 6-step spikes protocol because it's easy to forget key steps when you're under pressure. But adapt the idea for yourself. The idea is to have a prompt. SPIKE stands for setting up, perception, invitation, knowledge, empathy, and summary. So let's take a look at each one in turn. Where are you going to tell your patient? Many patients feel safer in their bed space, and sometimes it's not possible to take them to a quiet room. Who should be there? Are you going alone? If it's serious news, sometimes it helps to take a colleague, but check if the patient's okay with this. Explain that you have some news to discuss and ask her if there is anyone they would like to be present. Manage your time and their expectations. I have some results to discuss with you, and I'm hoping that we have about half an hour. I'm hoping that we will not be disturbed unless there's an emergency. Think about your body language and try and get on eye level with the patient. Take a deep breath and pause. Assess the patient's perception of his or her condition. Ask them to paraphrase what's happened so far. You can use a phrase or two such as, when you heard that result, what did you make of it? When you felt that pain, what did you make of it? This helps you gauge the amount of work you're going to need to do. If they're close to the facts, your news will need less explanation. But remember that confirmation can still come as a shock. If they are very far from understanding the impact of your news, you and the patient are going to have to need a bit longer. A good rule of thumb is the newer the symptoms, the less likely they have adjusted their expectations. Pay attention and initially use the patient's own words. You need to get a clear invitation from the patient to share your news. There is no easy path to tread between being too blunt and being so woolly that your patient is unclear about what they have been told. This takes time and practice and an appreciation of the impact of shock. Many times, very serious, shocking news requires a number of explanations before the person is able to take it all in. Fire a warning shot. The very fact that you have come to talk to your patient and set a time frame will have most people feeling apprehensive. Say, I have the results of your tests that I'd like to discuss with you. Check how much they want to know. Are you the sort of person who likes to know all the details, or do you just prefer the main headlines? This offers your patient a true choice. When you're giving information, speak slowly and pause. The average time that doctors take before interrupting their patients is 7 seconds. So take your time. Shock impacts on people's ability to process information. Give the information in small chunks, check for understanding. So, we've had a look at the mass in your chest and we have a result of the CT scan. So, it seems like the mass on the scan is a cancerous tumour. Try not to use medical language, or if you do, explain it very carefully and check back patient understands. Listen and respond to emotional reactions. Sounds like you're feeling quite overwhelmed. Sounds like you're asking me a question about how long you're going to live. We can get very muddled when we think about being empathic and say, well, either you are or you aren't. But actually demonstrating empathy is a skill, not a feeling. You don't need to experience the patient's feelings. They will wear you out. The key is to identify the feeling. You seem to be very shocked. I can hear you're very upset. I can see you're feeling very angry. And then acknowledge it. People feel validated when you get that right. When people are shocked and frightened, it's important to re-summarise and explain what's going to happen next. Encourage the patient's participation in decision-making by checking if they have any more questions right now, being mindful of the time. When people are very shocked, they often don't remember much of what is said, and so it's good to let them have a little time to take in what's been said and to formulate some questions. Explain you're going to go now. It's a good strategy to let them know when you will come back, and please do it if you say you will. But don't set up unrealistic expectations. Provide some realistic hope by reminding your patient that you're going to offer them the very best treatment. It will take time, experience and practice to master these skills, but hopefully this resource will go some way to helping you and your patients.